Welcome to 22 and 23. Today's topic is sexually transmitted infections. So what is a sexually transmitted infection, or an STI? You may also have heard the term STD, or sexually transmitted diseases. We more commonly refer to them as STIs, but STDs is still in use as well. So STIs are that. They are sexually transmitted infections. So any type of infection that can be transmitted between two individuals primarily through sexual activity is considered an STI. Now obviously there are some infections that can be passed between two individuals being intimate, but they don't always count as sexually transmitted because they can also be transmitted in other ways as well. So STIs are usually grouped into a few different categories. They can be bacterial, viral, and parasitic. Bacterial infections include things like gonorrhea and chlamydia and syphilis. Viral include things like HPV, herpes, and HIV. And parasitic includes things like trichomonas and pubic lice. The treatment for STIs varies depending on what type of STI it is. Bacterial STIs are usually very easily treated with an antibiotic. STIs that are viral usually can be managed with antiviral medicines, but treatment is not usually possible for viral infections. And parasitic infections are often easily treated with an antiparasitic or an antibacterial medication. The most important thing to know about STIs is that once you are sexually active, it is recommended that you get testing, just baseline testing. So most STI testing is oriented toward females, but males can also be very easily tested if they are symptomatic. So whenever someone starts having sex, it's recommended that they get some baseline STI labs, and this includes HIV, syphilis, depending on where you live, gonorrhea, and chlamydia. And then you can test for others if you're having other symptoms. And then once someone is sexually active, in particular, if you have female anatomy, it's recommended that you are tested yearly if you are under 25. And then once you're over 25, the testing changes to sort of an as-needed basis. For those with male anatomy, one-time screening testing at the start of sexual activity is good practice, and then testing thereafter is usually with symptoms. And then for men who have sex with men, the testing recommendations are a little bit different in that it is a higher risk of transmitting STIs, and basically anal sex just carries a higher risk, and so more frequent testing is recommended for men who have sex with men. One other thing to know is that this is separate from HPV, or human papillomavirus testing. HPV testing is very specific and different. It is again mainly focused on those with female anatomy, and it is done by a cervical sample swab, and that starts at the age of 21. So it's with a pap smear, and the sample is taken from then the cervix, which is at the end of the vagina and is the opening to the uterus. And HPV testing, or the pap smears, are done anywhere from 1 to 3 years. It depends on what the results are of your previous screening, but again, those start around the age of 21. Now, on to your questions. Question 1, if both my partner and I are virgins, will we be able to contract STIs from each other? Okay, so the direct, straightforward answer is no, but assuming that virginity to you both means no sort of sexual activity ever. It is possible to get STIs of the mouth, of the anus, and also of the vagina and of the penis as well. And so thinking a little bit outside the box here, if you say, I'm a virgin, and if what that means to you is no penis to vagina sex, but you've done oral sex, it is possible that you still have, usually HPV would be the most common one that would be transmitted that way, or herpes as well. So I would, again, answer your question with no, but make sure that you and your partner are clear on what virginity means to both of you. Question number 2. How do I, a girl, protect myself from STIs when having sex with another female? This is a great question. And so the answer is, for any type of anatomy, barrier methods and vaccines are a great way to protect yourself against STIs. Barrier methods include things like condoms and dental dams. A dental dam is basically a flat piece of latex or polyurethane that is used mostly for oral sex, so mouth to vagina, mouth to anus, and it is, you can even make one out of a condom. That's really easy to make, but that's the best way to protect yourself from STIs. For female to female sex, the risk of STI transmission is lower, but still very possible. So I love that you're asking about protection. And then vaccines. There are vaccines for HPV. Love it. But a lot of people don't think about hepatitis B also as a vaccine against an STI, which it is. So the other thing to think about when it's two females having sex is, are you using toys? If you're using a dildo, for example, it is good practice to clean the dildo between use, so between holes, between partners, but using a condom can also provide some extra protection too. Question number 3, can you give herpes to someone without symptoms? Yes. So there are basically 2 types of herpes. There's HSV-1, herpes of the mouth, which causes cold sores usually, and HSV-2, which usually causes genital herpes. However, it is possible to transmit herpes from the mouth to the genital area, and it's possible to transmit genital herpes to the mouth, and they would look pretty similar. So because HSV or herpes lives on the skin, it is possible to transmit it without having any active lesions. Having active lesions definitely increases the risk of transmission, but it is still possible without any lesions present. It's also possible to transmit herpes if you're on an antiviral or an anti-herpes medicine. So condoms, dental dams are going to be the best way to prevent transmission. Question number 4. I have the Nexplanon and my partner and I are STD free. I assume you've been tested. Good job. How protected are we from pregnancy without a condom? You are very protected. Nexplanon is fantastic at preventing pregnancy. It is not effective at preventing STDs. So going back to the question of what constitutes sex and testing, and keeping in mind that there are some things that are still transmitted that we don't routinely test for. And that would include HPV for younger people, as well as herpes. If someone doesn't have active lesions, we really don't test for herpes. And HPV, again, is something that is checked with cervical checks or pap smears, but it is possible for the HPV to be silent for many years before actually showing up on tests. So keep in mind that great job getting tested and knowing that you don't have any active STIs right now. It is still possible to transmit viruses without knowing it. So just keep that in mind and have those discussions of what kind of sex have you had and what are we actually at risk for here. All right, question number 5. My ex-girlfriend just told me she has chlamydia. I've never had sex with anyone else and I feel fine. Do I need to be checked? Yep, you do. So if you have a known exposure, you should go get checked. And the reason is that STIs, while they cause a variety of symptoms, whether you have a penis or a vagina, whether it's in the mouth or the anus, STIs can also sit silent. And in fact, with males, they're more often silent than in females. And so it is very important that you go get tested. All you have to do if you have male anatomy is just pee in a cup. So don't pee about an hour before you go get tested. Otherwise, you'll have to do a swab or wait an hour. But just pee in a cup, they'll check you and treat you. Question number 6. Do girls usually feel or see symptoms if they have an STD or an STI? No, they don't. So like I was just saying, no matter what your anatomy, it is possible to have an STI, specifically gonorrhea or chlamydia, without having any symptoms. And then if it's a virus, it certainly can lay what we would call dormant for a while. So you can have herpes and not have any active lesions. You can have HPV and that can take like a decade or two to show up. So it is possible to have an STI or an STD without having any symptoms. So that's why testing is important. Question 7. I was vaccinated for HPV when I was younger, but when I turned 16, I started getting genital warts and went to a gyno and was told I have HPV. How did this happen and what can I do to relieve itching and discomfort? So let's start with the purpose of vaccines. The purpose of vaccines is to stimulate your immune system to develop a memory for certain, usually viruses. We do have some for bacteria as well. But the whole point is that we are training your immune system to recognize if you were ever exposed to like HPV, to very quickly have an immune response and to kick out that virus right away. Vaccines don't always work. The other thing to know is that about this particular HPV vaccine, it depends on what type of vaccine you got. So the earliest vaccines only covered a few different strains of HPV, and now we have HPV vaccines that cover more strains. But what do I mean by that? So there are actually tons of different strains of HPV, but only a handful of them cause the cancers that we really worry about, like cervical cancer, penile cancer, mouth cancer, and then genital warts. So again, only two groups of strains are really responsible for most cancers and warts, and those are called high-risk strains, and those are the ones that are included in the vaccine. But not all strains are included in every vaccine, and in fact the earliest vaccines did not include all of the high-risk strains. So it's possible that depending on how old you are, you had one of the earlier vaccines that didn't cover all of the HPV, the high-risk strains, and that's why you still had some genital warts. Now, how to manage them. Talk to your doctor and or your dermatologist, and a lot of times you can manage these by freezing, like cryotherapy, and itching you can manage with topical anti-itch medicines too. But if you have a problem with recurrent warts, I would ask for a dermatologist referral or your gynecologist. All right, question number 8. Ever since I was 16, I've been sexually active, but recently it started hurting when I ejaculate. Specifically, my left testicle has a sharp pain. It's happened twice now in the last month, and I don't want to orgasm anymore. When I was 16, I had gonorrhea, but it got cured. So is this testicular cancer? Okay, so first of all, whenever someone does test positive for gonorrhea or chlamydia, we do recommend repeat testing 3 months later just to make sure that it's gone. So depending on how old you are now, it is worth getting repeat testing just to make sure that the gonorrhea is totally gone. Is this cancer? Very unlikely. This wouldn't be typically how cancer would present. If you do testicular exams, feeling for any lumps or bumps would be the most specific way to find any testicular cancer, but sharp pains really wouldn't be the main presentation of testicular cancer. Now, again, I think it's worth getting checked by an STI check just to make sure everything is gone and cleared out, but I would start there. Question number 9. How likely is it to get an STD from oral sex, and how do I know if I have one? So how likely is it? That's tough to answer, but usually when someone gets an STI of the mouth, it's going to be symptomatic, specifically sore throat, fevers, lymph node enlargement, things like that, except for HPV, which really, again, won't show up for decades. So again, I love the HPV vaccine for preventing that, but short term, if you were to catch something like gonorrhea of the mouth, it usually has symptoms. And then question 10. I was recently diagnosed with herpes and I feel like my life is over. But the point is, I'm scared to ask if my boyfriend is going to be able to give me oral sex in the future and if I can give it to him. Also, I know safe sex is the way to go now, but are we gonna have to always use a condom? This is tough. One, your life is not over. And some people have a flare of herpes and then really go a long time without having any flares. Like I said in an earlier question though, it is possible to give herpes to a partner without having any active lesions. This is why barrier methods are going to be the most effective way at preventing transmission. You can still have oral sex, and using a dental dam is going to be a really good idea for you. And then, yes, condoms are recommended if you do decide to go on a suppressive medication that can reduce the risk of transmitting herpes to your partner. It doesn't totally take away the risk, but it can help, and it prevents flares for you too. So your life is not over. A lot of people have herpes and it's just not really talked about, and it's difficult for us to test because we really wait until there's an active lesion to get that sample. So don't think you're alone in this. It's very common. It's just not frequently tested because we have to have active lesions. So don't lose hope. And there are a lot of great, like, they're flavored dental dams and condoms, little like ways that you can use a condom. Like there are fun ways to use a condom that can enhance your sexual activity. So don't be discouraged. This could be fun. And that'll do it for this round of 22 and 23.